Hey guys, this is Nicole. Welcome back to my channel, or if you're new here, welcome to my channel. I'm kind of all over the place. I make a lot of different types of videos. So if you like the messy, disorganized, and unpredictable type of YouTube channel, then I'm perfect for you. I kind of wanted to make a video just talking, just doing nothing but talking. I hope that I can actually articulate what I'm trying to say. But I just wanted to make a video about mental health and Crohn's disease. Or more general, mental health as someone with a chronic illness. And in my case, it's going to be focused on young people with chronic illnesses and how it affects your mental health. But as I said, I have Crohn's, so this is going to be based off of my experience. So I guess I'll start off with how I really got diagnosed. It was a very long process. I'm 20 now. I was first hospitalized when I was 16 for ileitis, which is an infection in your small intestine, and basically I had severe abdominal pain. I thought I was dying. I went to the emergency room and they told me that I have ileitis, and then they said they don't know why, but they're going to give me antibiotics and just keep me there for a few days and just keep me on an all liquid diet. So that's what happened. I was in the hospital for a few days, and then it seemed that I had gotten better, so they just sent me on my way. I started having more just random stomach pain and just issues in general. Just like trying to eat certain things and then just feeling really sick and like having cramping and stomach pains and bathroom problems and everything like that. So I was kind of in remission, I guess, from ages 16 to 19. And basically my first year of college was kind of hell because I was so stressed out. I had just moved to somewhere that I have never lived before, like was on my own, and I had college schoolwork. I was trying to do the best I could and get perfect grades, and I was working at a new job. It was just all too much at once, and I was just having horrible anxiety, and I could not sleep. I was having insomnia. I was irritable. I had a lot of frustration, and a lot of mental health issues in general. And I started to have problems sleeping, not only because of anxiety, but because my stomach acid was bubbling up into my throat at night, and like I had horrible stomach cramps. I felt like I was gonna throw up all the time. So this was at the age of 19 during college, and it was manageable, I guess, you know. I just didn't really eat much. I like lost a lot of weight, but it wasn't anything that, you know, sent me to the hospital at that point. But what really went wrong was after the first year of college. I was still 19, and it was officially summer. I ended a long-term relationship. I had a lot of stress in general from trying to get scholarships and trying to figure out how my second year of college was gonna go financially. And I was working throughout the summer too, and then dealing with a lot of other stuff. My health just was like, I'm done. At that point, I was in such extreme pain that I couldn't get out of bed. I had a heating pad. I would just lay in bed with my heating pad. I would try to go out somewhere with my friends, and I would have to go home because, you know, I was in so much pain, and I just felt like I couldn't be sitting up or standing up. I had to just be laying down, not eating much. I was using the restroom all the time. One night I was in such horrible pain that I just started having a panic attack and like crying and like screaming that I needed to go to the hospital. And this is actually the second time I went to the emergency room this summer, because the first time I went, it was because I thought I had ileitis again, so I just went to the emergency room because I felt like the same pain, and they told me nothing was wrong. So this second time that I went was when I was crying and having a panic attack. Like, I know something's wrong with me, I know they're gonna tell me nothing's wrong with me, but I still need to go to the emergency room because something is definitely wrong. Felt like the movie Alien, where someone is coming out of you, like, or something is trying to burst from your stomach. That's exactly what it felt like. And my back, because it was horrible lower back pain. It was just like the worst feeling ever. I just didn't, there was nothing that could get rid of it. I would just have to lay there and just like hate my life. Like, it was just, there was nothing that you could do. Like I said, they were like, oh, well, your blood tests are normal, you're fine. Like, I don't know what could be wrong. You might have, they said I might have stomach ulcers from stress, or I might just have food poisoning is what they said. And I was like, well, I've had this for months. I don't know about any food poisoning that lasts for months. So basically they recommended that I get a colonoscopy and also an endoscopy where they go down in your throat. So I did both of those. And they told me I have Crohn's and that I had inflammation all the way from my stomach down to my large intestine. Like, pretty much my whole digestional tract was fucked up. And that's why I was in so much pain. So yeah, there's a lot of other stuff that I kind of want to talk about in a different video that happened after that. But basically, in terms of mental health, it is really difficult for someone to remain the same person that they were before they got diagnosed after they're diagnosed. And what I mean by that is it's really difficult to enjoy the same things that you once enjoyed, and to talk about the same things you used to talk about, to go back to your life the way that it was. Like, almost impossible to just jump straight back into how you once were, when the whole time you were hoping that what was wrong with you was something that could just be fixed. I'm 20, so I guess I am an adult, but when you're a young person and you get thrown into such a serious situation, it's really difficult to feel young anymore, and to feel like you can enjoy being young and being careless and just enjoying not really having much to worry about in terms of like physical health. Like, you can go out drinking, eating junk food, staying out late with your friends, you know, doing so many things that you don't really think about as a privilege, I guess. And my main problem with mental health and having a chronic illness is that I feel obligated to still do things like that, like to still go out and enjoy my life and everything, you know, as everyone wants to do. But it just feels like there is this shadow. It sounds so dramatic, but it just feels kind of like there's something that's just kind of always there reminding me, you know, don't eat that, you're gonna feel sick. Don't stay out late, you're gonna be in pain. You know, don't forget to pick up your prescriptions. Don't forget that you have to take your Humira shot tomorrow. Don't forget to take that out. Like, don't forget that you have to do all this stuff that other people your age probably don't have to do. No, that's just when things are good. Even worse, it's like, I literally cannot get out of bed. I cannot do the things that you can do. I'm sorry if you don't want to be my friend anymore, because I'm no longer interesting, and that all that I talk about are things that, you know, 50-year-olds and older probably talk about in terms of their health. I lost a lot of people when I got diagnosed. And I don't mean, like, some of them it was just kind of like we drifted away because I was going through something and I kind of isolated myself and I did not talk to anybody because I was just trying to get myself right and just figure things out, you know. And I also had to leave college and I lost all the friends there because, you know, I lived in a different city after that. Everyone else just kind of like called me an attention seeker for complaining so much about what was going on with me, because that's how I would cope with it, is just talking about it. I hope that somebody can relate what I'm saying. And just know that if you're somebody out there with Crohn's or any other chronic illness who's a young person and you feel like most of your problems, you know, after everything is kind of settled down, once you've found medications that work for you and you feel like you're kind of going back to your normal life, there's still that just kind of despair that comes along with it. You know, I read a quote that said, "You're mourning the loss of your health." And yeah, I think that's really true. Like, when you're someone who's young and you just feel like there's this whole entire responsibility that you've had to adopt just because you're not healthy anymore. It's exhausting. It's like a full-time job trying to just take care of yourself after that. It's kind of like giving birth to a little newborn baby that you have to take care of and just constantly worry about. You know, it's not negotiable. It's something that you have to do. And I fucking hate that so much. I wish I could just not have to worry about it, you know? Just like everybody else, go to the doctor when you're sick with a cold and then just get some medication or just get a checkup, and then they're just like, okay, you're fine. Come back in a year or whatever. Mental health is something that most likely every young person with a chronic illness suffers with and struggles with. But it's not talked about. Most people just think about, you know, I'm sorry that your body doesn't work. I'm sorry that you have to take all these medications, and I'm sorry that you're sick. I'm sorry you physically feel bad. But people don't think about how that mentally affects you, you know? Just trying to have support and trying to figure out how to fit in with everyone else around me, and just trying to be a functional member of society and achieve what I want to and set out the goals that I have set out for myself from before I got sick. It's just really hard. And so I guess I haven't really provided very many tips because it's something I'm still going through myself, but I think it's just something that needs to be talked about. So I hope that you've enjoyed this video. It was pretty much a mess, but I'll see you next time with a new video. And I hope you have a great day. And be sure to like and subscribe if you liked it. Thanks for watching.